who is eligible for hospice?
Well, there are fairly strict Medicare criteria that are used, and they sound kind of hard and cold, but that's the way Medicare.
Well, that's the way Medicare is. Yeah, I know.
But the criteria are pretty straightforward. A patient or an individual has to be diagnosed with a terminal illness with a life expectancy of more likely than not of 6 months or less.
Right.
And if their physician certifies them as having that illness, and that more likely than not they're not going to survive more than 6 months, they're eligible for hospice. As simple as that.
Okay.
And they need 2 physicians to sign, and if their primary care physician signs, I'll sign.
Okay.
And circumstances can change, as I said, but really, that's the time people should, in my interest or in my
best advice.
Best advice would be, thank you, would be to when you are identified as having an illness that is potentially life-limiting, and your doctor is willing to sign and enroll you into hospice, and you yourself, you don't need your physician to refer you to hospice. You can call any person in the audience that's listening tonight or their family member. They can refer themselves to any hospice they want. They don't need a doctor to do it. They don't need a nurse to do it. They can identify themselves, just make a telephone call and say, I want to have hospice services. And if they meet that simple criteria. Then we can start hospice care the following day.
That's right.
And if at 6 months they've responded to the care we provide, they don't have to disenroll. We just...
You don't kick them out?
Nope.
Okay, good to hear.
Then it's up to me. I recertify and I recertify and I recertify as far as the eye can see. As long as they need hospice care, we're going to give it.
That's wonderful.